Hello, everyone. This is Ify again, Nurse Ify. Today, I am going to be talking about the study guide, just like you see in the title, um, for exam 6. So, for those of you who really need to pass this class, especially to continue the program, I am going to be talking about it today, tomorrow, and the rest of this weekend. I have a couple of them. Today, I am going to be talking about the immuno response system. So, um, immune response, I'm going to be looking down because I have my notes right here. So, if you see me looking down, that's why I'm looking down to see my notes. And don't forget to subscribe and to share the video to the rest of your classmates, those who need this video. So today, the immune response is a target of a specific um, system of defense. So in our body, we have that system in our body that kind of, when they come in contact with foreign agents, we have that immune system that kind of fight for us. So when somebody begins to have that part of the immune system being attacked, that is not a good thing. We call it like it has some autoimmune disease whereby the body is attacking the organs or that part of the body, some part of the body. There are many type of immunities we have. We have the natural acquired immunity, which occurs as a result of infection or a periodical microorganism. So the second one is the artificial acquired active immunity, which is the administration of the killer or weakened organism or toxin. Then the memory cell is produced by the B leukocyte. So that way, when you come in contact with this disease, then it just remembers it. So, say, like when we get flu shot, so we got this disease in our system. So, when the real flu comes into our body, it kind of recognizes it and it's able to attack it. Then the passive immunity is the antibody are given to produce a temporary protection from an invader of the agent, like the artificial, just like the artificial acquired active immunity. So there is a memory cell. There is a memory cell that is there to remember what is to remember this particular bacteria and begin to fight it. So it's just to mimic. So they mimic this bacteria and inject on you. That is all what this vaccine or is. So when they come in contact with the real pathogen or infection, they are able to remember this through our B cells in the body. Okay, so the second one I'm going to talk about is the rheumatoid arthritis, RA, commonly known as RA, rheumatoid arthritis. So RA, I'm going to call it more an RA, which is the arthritis, rheumatoid arthritis. It is a common progressive inflammatory disease. It can affect the organ. Mainly, it attacks the joints, bilateral and symmetrical. So if it's attacking the right joint, it will also be attacking the left joint. It also normally affects the upper part of the joint first. It is caused by the white blood cell attacking the synovial tissue. Therefore, it can it become inflamed and thickened. This inflammation extends to the cartilage, the bone, the tendon, and the ligaments that surrounds that joint. This bone is erosion and the joint deformation can also result to these changes. So rheumatoid arthritis also can be systematic disease that can affect the connective tissue of the body. It can also affect the blood vessels, the eyes and the pleural cavity and the pleural. So these people that have this disease usually deformate, it's usually deformatory, and they mostly complain about pain. Pain is one of the most common pain that they complain about. So usually this pain is usually common in a particular time of the day, which is usually comes up in the morning. They come up with some stiffness in their joint or wherever that's affected. So at this time, I will be talking about the treatment or the nursing care for patients with rheumatoid arthritis, the RA. So the first thing as a nurse is you can apply heat or cold to the affected area on the client. In the morning, there is stiffness, so the patient is advised to use like a hot shower, which can relieve the pain. Pain in the hand and the finger, then can use like a heat. If there is an edema, like swollen, you can use a cold therapy. Secondly, the nurse is to encourage a physical activity to maintain joint mobility within the ability of the client. So encourage the patient to move. Movement is very important. Then the third one is to monitor for indication of fatigue. So the fourth is enhance teaching to the client about the measures to do the following. One, maximize functional activity, minimize pain, then monitor the skin closely. Ask the patient to conserve energy, space out activity, take rest in between periods of activity. Ask clients for additional assistance. Ask them to ask for additional assistance when needed because they need rest. Secondly, I think that will be number 5. Number 5 is to provide safe environment. Safe environment, they refer them for physical therapy and occupational therapy. Because sometimes the hands are so deformed that they cannot even able to pick up a fork or a spoon to use the normal way. So with physical therapy and occupational therapy, patients can be able to, use their forks, or they do the activities of normal living like they have been able to do before, or manage it successfully. Then we should also provide information for support organization. Support in the sense that people with this disease sometimes can be very depressed, looking at your hands and joint with pain and waking up with different pain. So it's good to refer them to certain to support group and organizations that can, help them with what they are going through. Sometimes problem shared is problem solved, because when you know that you are not the only one going through such thing, that can be very encouraging or able to help you to manage the disease. So as a nurse, you should be able to find support organizations for them, facilitate the use of assistant device. So if they can use a walker, we should help them with use of walker, whatever that can assist them with their daily activities. So that way movement can be encouraged as much as they can. There's on this one we said, finally remove unnecessary equipment and the supply. So those things that will be on the way for the patient should be removed. Those things that are unnecessary and not needed around them, especially in a room. You don't want it to be clustered with all the stuff on the way, especially if they're getting up and using their walker to the bathroom and all that. So make sure those things are out of the way to prevent fall and further injury. Then number 6, use progressive muscle relaxation. Ask patients to use muscle relaxation to enable them maintain or improve the pain. Administer medication and the proper positioning as ordered. Monitor medication if side effects, and reduce pain or increase mobility. So instruct the client regarding the manifestation that need to be reported immediately: fever, infection, pain upon inspiration. And so when you see patient has an infection, he has a fever, and he has a pain, these things need to be reported immediately. Okay, so this is one of the things that it's in the study guide. So the next thing is the medication. So one of the medications a patient on the RA is usually prescribed for them is a non-steroid anti-inflammatory drugs. This treatment between with NSAID, commonly known as NSAID. The NSAID provide analgesic and anti-inflammatory effect on the body. So with these people, you start with NSAID, but NSAID can also cause some GI distress. So we should monitor for GI distress. But this is the first medication that is usually given to patients with RA. So some nursing consideration for this patient should be request. Some nursing action is request a concurrent prescription for the GI. Excuse me. Request a concurrent prescription for GI acid lowering agent like antihistamine, histamine receptor antagonist like Protonix. So this medication can be given to patient to prevent the GI distress. So if the patient reports of any of those. We should also monitor for fluid retention and hypertension, kidney dysfunction. So make sure you also educate the patient. Patient education is very important in this area. Educate the patient about the medication, that this medication should be taken with food or water, full glass of water or milk. If NSAID is routine, then there should be a Protonix given also with this prescription. We should, like I said earlier, observe the patient for bleeding. If you see the stool becoming dark, tarry stool, or any vomit that is kind of coffee color, so it's something that needs to be checked out because this patient might be bleeding, and that is one of the problem with NSAID. So teach the patient to avoid alcohol, which can increase the risk of GI complication. So it's a very important thing when the patient is on this medication. NSAID is the first medication that for treating this, but the NSAID has a lot of side effects with that, like GI distress. So we're saying that if patient is on this medication NSAID, we should make sure that the patient observe the patient for any stomach distress. If there is any stomach distress, we should inform the doctor about it. So there should be an order for Protonix to help eliminate this distress in the stomach, and also advise the patient to drink a full cup of water when taking this or eat with food. So it should not be taken in an empty stomach. Okay, so the next one is steroid, corticosteroid. The most common steroid is the prednisone. The prednisone are strong anti-inflammatory medication that can be given when there is acute exacerbation or advanced form of the disease, when the disease has gone up or when in time of acute exacerbation. So they are not given for long-term therapy due to the adverse effects of osteoporosis, hyperglycemia, and the immunosuppression and cataracts. So this prednisone steroid is given for a short period. It is usually given in advanced stage or when there is an acute exacerbation of this disease. So it's given for a period and then it's weaned out because of the side effects. And one of the side effects of the prednisone, I said, is osteoporosis, hyperglycemia, immunosuppression, and cataracts. So what are the nursing actions? So we begin to one of the things, if a patient is on prednisone, what are the nursing actions? What do you do? Watch the patient, observe the patient for cushioning, these changes. So monitor the weight and the blood pressure of this patient. So educate the patient to observe any changes in vision, blood sugar, blood glucose, and impair healing. So avoid crowd, follow the prescription, alternate days of dose, and tape down and discontinue medication. So most times when people are on prednisone in the hospital, we normally check their blood sugar. I've heard some of them say, "Oh, I'm not diabetic. Why are they checking my blood sugar?" So some doctors order for their blood sugar to be checked when they are on steroid, because what it does is that it increases the sugar level. So when they are going home with this medication, we have to inform them to check their blood sugar. We also inform them to monitor their blood pressure and monitor their vision, because it can affect the vision, and teach the patient also that these drugs are to be taped down. Usually the doctor put it, you take 2 tablets today, then tomorrow you start for 3 days, then the fourth day you start taking 1, then the next day you take half, and then the next day, then that way they stopped it. So that is how it's done. These medications are not the medication that you continue to take continuously. So this is how this treatment is done. So, like in your study guide, it says the goal for the treatment of rheumatoid arthritis. So the treatment first thing we do is we start with NSAID, but the side effect of NSAID is GI bleed and GI distress. So GI distress, if the patient start complaining about GI distress, we need to put the patient on the Protonix. When the Protonix is, when I say we need, I don't mean we don't order, because we are nurses, we are not doctors. Doctors do the ordering. So I mean, with when I say we need, I just mean like the healthcare professional or the doctors put them on that medication. So they are kept in that medication to help prevent stomach distress and GI distress, and patient is advised to start to take this medication with food in their stomach or with full glass of water or milk. But when it is in the advanced stage or in acute exacerbation, we always want the patient to start on steroid. And one of the most common steroid they use is the prednisone. And prednisone, I have just said that the side effects of medications prednisone is osteoporosis, hyperglycemia, and immunosuppression, cataracts. So educate patients to monitor eye vision, blood glucose, and also impaired healing. So patient in this medication is also advised to avoid crowd and make sure that these medications are taped down. Thank you. And this is the end of this lecture today. We will continue tomorrow. I will put in some video down. So subscribe, share the video, and to your friends and the classmates. I wish you guys the best of luck preparing for this test.